Hello, I'm Dr. Zavaro from Healthy Pets Veterinary Hospital in Spring Hill, Tennessee. We're back again. Last month we talked about fleas and we specifically went over the flea life cycle. And one of the things that we noted was that we could get rid of fleas 100%. This month our news is not as good. We're going to talk about ticks. We're going to talk a little about their life cycle, but we're going to explain the differences of fleas and ticks and some of the reasons that we do have problems with them. One thing that's very important about ticks, fleas can spread some diseases, but ticks can really spread diseases that can also affect us. When you have a disease that affects dogs and cats, it's called zoonosis. So there are zoonotic diseases that we share, and a lot of those are spread by ticks. One of the reasons why it's so tough to get rid of ticks is that there are multiple tick species. We're going to concentrate mainly and talk about mainly 6 species that affects dogs and cats. They have a long life cycle. A tick can live up to 600 days before it takes a blood meal. And so what that means is they crawl up a blade of grass and they will just stand out with their feelers and wait until somebody, a dog, a cat, a person, or a wildlife walks by and grab onto that person. And they'll walk up and down that blade of grass up to 600 days before they grab on to an animal. So at night, or when they get dehydrated from the sun, they'll walk back down under the rubble and they will absorb nutrients that way, and then they'll walk back up and down. So if you can imagine, you're getting it 2 years there before they have to eat a blood meal, before they molt and change to another stage. Usually that's the nymph that has that, but before they become an adult, they can live that long. So that's one reason why we have a lot of trouble with ticks. The other thing is their high reproductive capacity. Adult ticks can have a lot of eggs and a lot of nymphs and larvae from them. Also, the wildlife hosts that we share, that ticks have, it's hard to control if you have a lot of ticks on wildlife because we don't have products that we can control for them. Important diseases that can be spread to dogs that can also be shared with humans include Lyme's disease. And so Lyme's disease is something that I test for if I have a dog that is sick and I think that they might have a tick-borne disease. Rocky Mountain spotted fever, dogs can get that as well. And then ehrlichiosis. And actually, my personal dog at home got ehrlichiosis about 2 years ago. She is on a tick preventative, but it's one of those things that prevention, you prevent. But unfortunately with ticks, we will still have some that will latch onto our dogs and cats and will stay there longer than necessary, and that can spread a disease. Studies have shown that it takes 24 to 48 hours of a tick attachment before it can spread one of these diseases. Now that's a controlled study. I'm not sure if that's totally accurate. I feel like that we need to try to remove ticks as soon as we see them, and we need to put them on prevention so that they will fall off as quick as possible. But I don't think you could guarantee that if they were only on there for 24 hours, could it spread disease or not. Cats, there's a very serious disease in cats. It's called cytox zoonosis, and cytox in the literature shows that it's 98% fatal. They just came out with another treatment for it recently. It's very expensive. I have some friends, some veterinarians that have tried using the treatment, and it's something that we will be looking into as far as trying to treat that. Now, the only product that we have for ticks in cats is Frontline Plus. There are actually not hardly any studies on ticks in cats, but Frontline got they actually got, from the FDA, they got approval to use this on cats, and it works very well. So my recommendation, if you have an outside cat, it must be on Frontline Plus because they've got to have a tick prevention. You don't want them to get that type of a disease. We also have Frontline for dogs, and that works very well for ticks. Canine Advantix does fleas and ticks as well. My dog at home is on a Prevent-Tick collar. This is a collar that a dog wears for 3 months. The label on here says 3 months. usually lasts me about 2.5 months, and then it's time again to put another collar on. These collars have the active ingredient amitraz in them, and they are lethal to cats. So you have to be careful when you're choosing tick products on your dogs, and make sure you're using the right ones. There are some over-the-counter products that you can buy. I would be very careful with those and make sure that you use the right product. If you see a tick on your dog and it's already on there, your dog's already on a prevention, I do recommend that you pull it off. You want to make sure that when you pull the tick off that you get all of the tick, and the main thing is the head. If you leave the head inside the animal, then they can get an abscess and a little infection there. As far as dogs spreading their diseases to people, it's not really a problem. I don't have to worry about getting ehrlichiosis from my dog. But it is something that we can get from ticks. So it's not a zoonotic disease I'm going to get from my dog, but it is a zoonotic disease that we could share. And so that's the important take-home message. The other thing is to understand the products that we're using. And what I want to explain is most of these products are about 98% effective for the first few weeks. As far as our topicals like Frontline and Advantix. The numbers that you see there, what you have to realize is 98% effectiveness is a really good effective number. But for instance, if your dog goes through the woods and they're exposed to 100 ticks, which is very possible, then they're still going to have 2 ticks on them if your product is working effectively. And so owners will see their dog after running through the woods. They may see 2 ticks, or if it was exposed to 200 ticks, they may see 4 ticks on their dog. And the first thing they're going to think is that their product is failing. It is probably, their dog has probably had a large load of ticks that it has been exposed to. And so if we see a few ticks on our dogs and they're on prevention, that's okay. If you're seeing a whole lot on Frontline, I would recommend changing to the Prevent Tick collar like I do. You can use them together. Once you get out to 4 weeks, it is very possible the effectiveness can go down to 96%. That means that every 100 ticks that your dog's exposed to, they may see 4. And so clients and I don't like to see ticks on our dogs because they're really nasty looking. We feel like our dogs are really being infested with them. But we've got to remember, if you see them on there, pull them off, make sure you get their head, and make sure that you're keeping up with your tick preventative. As soon as new tick products come out, we'll have to make sure they're very safe because they usually have to be really strong. As the tick's life cycles change a little bit, and there might be some resistance problems that we have with them. I think tick diseases are going to be our next big problem. I'm seeing a lot more tick diseases in dogs, and I'm seeing a lot more ticks on dogs. So it's something that we've got to really watch, and if your dog goes outside, you've got to prevent. So make sure that your dog is on Frontline, Advantix, or a tick collar, and make sure if you have an outside cat that you have them on Frontline. Prevention, prevention, prevention. Thank you so much. Dr. John Zavaro at Healthy Pets Veterinary Hospital in Spring Hill, Tennessee. Have a great day.